Good afternoon and welcome to today's Medtech32 SMS Webinar. My name's Caroline Birkinshaw and I'm one of the training team here at Medtech. We have probably quite a few less people attending than registered, so there may be people joining as we go through the webinar, but hopefully they will come along shortly. So you should all be able to see my screen. And first of all, for those people who've joined the webinar who are not using the Medtech SMS system and would like to, contact our sales team. So sales@medtechglobal.com, and they will sort out the paperwork for you. Once you receive that, you'll be sent the SMS credentials and we will provide some assistance to get you started. There's also what will be very useful when you're starting out using the SMS system, or even if you've been using it for a while but not quite sure if you're using it to its full advantage. You can go to our web insight portal, the customer insight portal, and under the download section, just got to log in again, hang on. In Insight, you can go to downloads and to the Medtech training guides, which is here. And in here, you'll find the SMS training guide. Now, it was there this morning because I picked it up. Here it is. So the configuration and user guide. So a lot of the configuration used and learning how to use the SMS can be done without any training at all. So feel free to get started on it once you've got your credentials loaded. One of the things just to mention at this point is that most of you who've been using the SMS for a while, sometimes the texts don't get sent. And this is usually due to the Medtech services not running or having needing to be rebooted. So before you contact the customer care team, it's quite a good idea to do this because that's the first thing they're going to ask you to do anyway. And if it's on the server and your server's in the cloud, you will need to ask your cloud team to do this for you. If you have a server on site, then you can type in here services, and it will come up with the services app. So when you click on the services app, you'll get this list here. Find the Medtech services. So scroll down until you get to the Medtech services and just click on here. You can either restart the service or stop. Restarting is usually all you need to do. It doesn't interrupt your Medtech work or your workers. So this often will, it'd be like the olden days when we always used to say reboot your computer before troubleshooting any other options. So it's a bit like just rebooting your services. And this will often get your text messages flowing again. If that doesn't work, then certainly contact the customer service team. Okay. So when you're going to use the texting service in Medtech, one of the first things that is a good idea to set up are these 4 tools on your toolbar. So this one is the outbox, which I'll cover what all these do and what they all mean shortly. But to get the tools on the toolbar, you want the outbox, the inbox, rejected SMSs, and the patient palette SMS. So pop those onto your toolbar, and that will make accessing the various parts of the SMS a lot easier. So to get started with the setup, we go to the Manage My Health menu. A lot of people say to me, oh, but we're not registered for Manage My Health. To use the text service, as long as you have the text service or the SMS service credentials, you will be able to use the SMS text service, whether you have signed up for Manage My Health or not. So come into the SMS text message service, and we're going to start with setup. And this pops this box open. Down here is where you load your credentials that you'll be sent once you have signed your SMS contract with Medtech. So once they're in, you can then activate Manage My Health SMS for this practice. You can choose whether or not you would like SMSs not to be sent between certain hours of the day. So say from 5 o'clock, 6 o'clock, through to 7 o'clock in the morning. You can select those 2 times here, and no text messages will be sent out during that time. If you would like to use the appointment book reminders, this allows the system to automatically send out text messages to remind people that their appointment's due. You can select, but put a tick in here if this is what you would like to do. The first appointment reminder can be set to whatever time frame you like. So it could be 1 hour before the appointment, or it could be 1 day before the appointment. And you can decide whether or not you want a second appointment reminder sent out. So this would be where you would put the time frame for the second appointment reminder. You will need to decide whether you would like to use queue reminders. So people who are using the queue appointment book may wish to use the queue appointment reminders, and we'll go through how they work shortly. You can decide whether or not you would like to send text messages to people from a query, and we'll cover that. You can decide whether you would like staff to be able to send text messages from the patient palette, this is the palette here. And so we can use this icon here to send a text message to a patient. And whether or not you would like your recalls to be able to receive text messages. In the Staff Setup tab, you will need to enable each staff member access to sending text messages. So I'm logged in here today as Dr. Eves. She's here, and I've allowed text messages from his appointment template. I'm allowing queue messages because he works on the queue sometimes. He can send text messages to random patients, and he can do queries and send text messages, and he can do recalls. So whilst it's set up here that people can use these functions, each individual staff member has to be assigned the rights to do this. So just tick off what is applicable. And again, this takes some maintenance as well, because if you get new staff members, then you will need to come in here at a later date and give them the access that they need also. In order to send text messages out through appointment reminders, you will need to set up an SMS appointment template. And that is what is selected here. So if we come out of here for a moment and go into Setup, in Outbox, Outbox Documents. So in here is where you would set up your text messages templates. So if you haven't already done this, I have one I did earlier. So it's the same as setting up an Outbox document, with the exception that the format, instead of being text or Word, must be SMS. So your choices here are health documents, a Manage My Health document, a text message, which is text, not text, and SMS and Word. So select the SMS for Word and go into the document. Now, text messages can only be have 156 characters. Otherwise, if they're more than 156 characters, which includes spaces, then they will send us 2 text messages. So firstly, that's more expensive for you as a practice because you're sending out twice as many as you would do otherwise. And in some cases, patients on their plan pay to receive text messages, and so again they're paying twice as much as they would need to. So try and keep your text messages to at least 156 or under, including spaces and characters, so the brackets would also be counted as a space, as a character. One of the things you can do is preview your message using the preview option, which will show you can count them there. So again, remember SMS format. That's makes it the difference between an outbox document and a text document. So once you've set up your SMS for your appointment reminders, so as I said, this one says, hi, whoever the first name is, but text messages usually use first names rather than formal names. This is a test message. So you could write in here, this is a reminder for your appointment, which is due on. Now you need to then insert the field to pick up the appointment date and time. So that is under the insert column here, and you'll need the patient encounters. Encounter slip keywords. And here you have the date of the appointment and the time of the appointment, and you can pop those into your, you can put those side by side in here, and then that will tell the patient the date and time of their appointment. The other thing that's a good idea in this, we'll talk about it again a bit later on, but another good idea here is to put, please do not reply, please do not reply. It reminds the patients not to reply to your text messages. You could also put, please do not reply, phone, and your phone number, and that will encourage patients to phone you if they have a query about the message that they've received. Okay, so once you've set up your SMS template for your appointment reminders, come into setup, come into manage my health, SMS setup, and attach it here. So this will take you into your SMS text messages that you have created, and you can choose the one that you want to use for your appointments. So that's about setting things up and getting going. If you have any questions regarding today's webinar, please, you can type them into the questions section. We don't take you off mute because there's too many people talking at once, and then it becomes very difficult for anyone to hear anything. So please type your questions, and we'll have a questions and answer session at the end. Now, when you the other thing that is often not noticed is you can use the icons down here to quickly see how many credits you have left in your text messages. So this is a little icon that sits in the very bottom tray. It's got a blue SMS button on it. So if we click on here, I don't have a plan set up, so I can't see it, but it can tell you what your credit balance is for your text messages. So when you come to our service, you'll choose a plan, and this will give you that information on how many text messages you have left. The other thing in the setup also is the standard audit log. So we have an audit log here, and you can see the practice audit log and the staff audit log. So you can see who has made changes to the setup, and we've got the practice set up as well. Okay, so if we go to the patient register next. So one of the criteria that you must have to send a text message out is the patient's mobile phone number, and it needs to be in the mobile phone number field, otherwise it won't work. Don't put spaces in, leave the spaces out. And also you can double check that your SMS message is valid by clicking on the little question mark. So if somebody's given you a text message with too many numbers in, then, or you've made a typo and typed in 023 because there are no 023 numbers, then it will come up that it's not a valid number, which I can show you. That if I type in, instead of 021, I have to type in 024, and it will tell me that this cell phone number is invalid, and it will change into a red color. So make sure that your phone number is valid and there's no spaces between. And the other thing on the patient register screen is an option to tick that the patient does not wish to receive text messages. So by putting in a tick in this tick box, even though they have provided a mobile number, the patient has indicated that they do not wish to receive text messages. And that can be quite handy. So when a patient has made an appointment, we make an appointment in here for this patient. By opening up the message, by opening up the appointment, you can see whether the text message has gone out. So it will have a tick in here. So text messages, text reminder 1 or text reminder 2 will indicate whether or not the patient has received or had their message sent out to them. And by clicking on the little ellipsis buttons at the end, you can open up the message itself. It's going to not do that because I haven't set it up properly. So you can see the message that the patient received. So on the patient palette, we can send messages directly from here as well. So by clicking on the icon with the red T, we can send a text message directly to a patient. So these would be one-off text messages that you want to maybe notify the patient that the doctor's running quite a bit late. It's quite simple and easy to send them a quick message to say that. So here we have an option to choose a template. So from your SMS templates that you've set up in the outbox document area, you can select whichever text template you want to send. So I can pop that in there, and it tells you here how many characters there are in this text message. So I say the 156 characters is important here as well, and it will tell you how many text messages will be sent if you send this message. The text message will go out usually about 5 minutes after it's been created, and you can change the date here if you time. If you want it to go out at a different time, you can also change the date and the time. If you want it to go out not straight away, but you want to delay it going out, you can change the date and time here. There's also this option here for related family members. So when you send a text message from the palette, a copy of it is lodged into the daily record. So if the text message was in regard to, say, a child, you obviously don't want to send the text message to a child if they're under 16. You want to send it to their family, but you want the actual text message to go into the child's daily record. Then you can click on family members and send the message to the family list will be here with the family list of mobile numbers. You can send that message to another family member. Also in this box, if you're sending a text message to a patient asking them to do something, then you might want to set up a reminder for yourself in the tasks to see if the patient has actually actioned what you've asked them to do. So I can set up a reminder for, say, a week's time, and I can send it to myself and make sure that this patient has done whatever it was that I've asked them to do. So I can just put in follow up to follow up on the text message I've sent them. Okay, so that's as easy as sending sorry, beg pardon. The other thing is, if we take out the template, you don't have to use a template. Just take that out. You can just type a message straight in. Dear, hi, please contact practice. So that's a simple message that you can send out directly from the patient palette. If you want to send a text message out to patients that are on the queue, to do that, we're going to just go and open the queue up. And we'll drop the patient into the queue. Now, these were defaulting to Q2. Pardon, I'll come in here. There we go. And because I've got one here, I can send, I've only got one patient here, I can send this patient a message. If you've got a number of patients in the queue and you want to send a message to all of them, just click on them and hold the shift key down and select each patient, and each patient will get the text message that you compose and send to them, or the template that you use. So again, quite simple and straightforward. So it's using the text message here. But in order to do this, remember, so if your text icon here is blank, remember in the setup, you must have this ticked. If it's not ticked, you will not be able to send text messages from the queue, or from the palette for that matter. So you won't. So if your icon here is grayed out, you put it on your toolbar but it's not working, come in here and check that there's a tick box in the palette and the queue according to what you require, and that the tick box is set up for the correct staff members as well. So sometimes these little details are overlooked, especially once you've been using the text service for a while and you want a new staff member, you've got a new staff member. So some of the those are the simple setups for the basic text messages that we send out. So the other areas that you can send a text message out is from the recall contact list. So if we go in and look at the recall contact list, so the nurses might want to send out some text messages to the patients. So again, first off, we must have a mobile phone number. So we can't send this patient a text message because we don't have a mobile phone number for this patient. You'll also see any spaces in here as well, and they can go and be corrected before you send it out. The other criteria for sending text messages out to patients is that there must be an associated SMS document or SMS message for this particular recall. So you can see I have one for smears, but I don't have one for mammography or flu vaccine or zoster. So we'll go and have a look and see how that's done. I'll close this for a second and go into the Medtech setup, recall screening, and first of all, we'll set one up for mammography. So we go to screening terms, you find the screening term that you're looking for, and in this case, I'm going to do one for mammography. And in here, you will see the recall SMS. So in here is where you attach your SMS message that you set up in the in outbox document with the format of SMS. So choose the message that you've set and go OK. So I didn't set one up specifically for this message, so I've just used one that was there. So that's how so now if I go in to the recall contact list, okay, you will now see that the mammography screening term now has an associated SMS message. And we need then, if we want to send one out for our vaccine and our vaccine groups, we need to do the same thing here. So again, I will close this and we'll go to Setup, Recall Screening, vaccine group. And because the flu 65 is part of a vaccine group, we could find that group, which is here. And again, we've got the SMS document here, which needs to be selected and the SMS document applied. We'll do this one. And finally, the last one is for vaccine, that's not applied to a vaccine group. So usually a non-scheduled vaccine. So we look at vaccine, and in this case, we were going to do zoster vaccine. So this one here. So when we open this vaccine up, again, we've got an SMS document field here, which needs to be filled in. Okay. So I can close this now and go back into my recall contact list. Okay, and now you'll see, move it over here. Right, the zoster vaccine. Oh, for some reason the flu vaccine didn't. I apologise. I probably didn't click OK. But we've got the zoster vaccine and we've got the mammography. So now they have an associated SMS template. And for those that have an associated template and a mobile phone number, we can select this option here, which says send text messages for all recalls that have an associated recall SMS and the patient has not already been contacted. So even if I had put a tick in here, then that patient would not receive a text message, even though I've sent the bulk text messages out. Okay. For some reason, you may choose not to send specific patients a text message, and that allows you to skip those ones. Okay. So for those of you who came to last week's webinar, I did cover the SMS messages from a query builder, but we'll go over them again today as well, in case you didn't come to that webinar last week. So going to the query builder, we can draw up a list of patients and send all of those patients a text message. So likewise, like with all the other ones, we need to have created the text message in the setup in outbox document first. So generally speaking, that's always the first port of call to go to set up your text message that you want to send to the patients that you're sending them out to. So then in my query store, I have one I set up earlier. A text query is what I've called it. So you can call yours whatever you like. And once you've set your query up, is to save it in the query store. So when you're sending out queries through the query builder, you need to, in your where column, you need to have the patient's cell phone is not blank, because you're not wanting to pull up patients that don't have a cell phone. Also, it's a very good idea to include in your query no SMS. So you'll find this field under the tables. We come down here to SMS tables, and it says here no SMS. So when we open that up, patient has no SMS. The patient is ticked no SMS. Sorry, no, that's the wrong one. Beg your pardon. It's no SMS. SMS. Come to the wrong table. SMS. From here, from no SMS. Sorry, from the patient palette. I beg your pardon. I do know what I'm talking about. Sometimes it just goes straight out of my head. So from the patient palette, so because this tick box is on the F3 screen, so the tick box for this is on the patient palette, and you just come down until you find no SMS. Too far. There it is. Oh, skip past it. There it is there. So this field here should go in here. So it says it is not ticked. If we look at it, how it's presented, we go to the condition, we open up the condition, and it is not ticked. And that's the field that you need to put in. And in this case, I've selected all my registered patients, but you could select all your patient is one, or you could select all your enrolled patients. So some criteria to define the group of patients that you want to send the text message out to. So you can continue to build this query. So you might want to add patients who have a recall, or who do not have a recall, or who have a screening term, or who have been classified. So if you watch the previous week's webinar, we did cover a lot of this information in that webinar. It's in the Insight portal under Medtech32 webinars. And these webinars are all loaded up onto Insight, usually the same day that we run them. If it's not possible to get them up that evening, then they will be done the following day. So you will be able to see this webinar at any time. You can refer back to it, and you can also watch last week's as well. So we've got our 3 fields in here, and then in the bottom box, we need to have the patient's cell phone number, and very importantly, the field that says ID for merge. That is also in the patient table. So if we come up here, and we've got more, and we've got ID for merge, that's this field here. You will not be able to send the text message out if you don't include this field in your query. So when we run the query now, whoops, beg your pardon, when we run the SMS query, so we need to run this box, not run the query, run the SMS query. You will get a ticks box here, and you'll get your 2 columns here. You can ignore the ID column, it doesn't actually do anything, but we need to pay attention to these 2 columns here. Check first of all that you haven't got spaces, and go back and fix those and run the query again. And that they all start with a 021 or an 022, otherwise you won't be able to send them. So the first thing I'm going to do is right click on the cell phone column and choose this as my mobile phone column. So set the column as mobile phone. And then I'm going to come to my tick box selection, and I'm going to select all. And it will not put ticks in phone numbers that are either not valid or have spaces in them. So because I've left this one, it has spaces, and I've left it here, then it will not put a tick in the tick box. This one also is both. It has a space in it and it isn't valid. So it won't send that text message out either. Then I can go to my text message button, my SMS button here, and I can compose my message. So it's telling me that I've got 27 people in my SMS. Do I want to continue? Go yes. Some people have built SMS queries that contain 1,000 patients. And so that little checkbox allows you to not continue because you didn't actually mean to bring up 1,000 people in your query. And you can go back and have a look at your query and find out why you've got more people in there than you anticipated. So from the template, again, I would choose my template. If I haven't set up a template, I can type my message straight into the little box here and send them that message out if I didn't want to create a template for it. So it's the same box as we went through from the patient palette composition of an SMS, so the same rules apply. And once you've either typed your message in or you've chosen a template, I will actually do that and go OK. I don't have my services turned on, so those people are not actually going to get text messages, so don't worry about that. Okay, so the next section we want to have a look at is the outbox, the inbox, and the rejected. So these are these three icons on the toolbar here. So with the outbox, this just shows me how many text messages are going to go out. Now the filter is set for the patient that's on the pallet. So you want to see all of your outbox messages waiting to be sent. You need to click on the filter, the little rainbow symbol, and take the patient's name out. And go OK, and you can put a date range in of how far you want to look back. Okay, and these are all my query builder text messages that I have just created, and they're waiting to be sent. As I said, they won't go, they'll just stay there. Oops, need that. Okay. Then likewise, in my inbox, I can do the same. I can filter for everyone or just the patient that I have on the screen. And again, I can look back as far as I wish. So I go, okay, I don't actually have any. So because I haven't sent any text messages, so nobody's replied. But this is a very important area for your management staff to look after. Because when you send a text message, you can't actually stop a patient from replying to it. Even if you put do not reply into your message, occasionally people do reply to them. Most cases, the replies are, oh, okay, thank you, thanks for that. So they can be ignored. In here, it will tell you the message that's been returned to you. So most of them can be ignored, but you may occasionally get an important message come back to you via the patient inbox, SMS inbox. So it's a good idea, a good practice, best practice is for somebody or some people to check on this a few times a day, just to make sure that patients have not sent a reply to your text messages and it is something important, even though they shouldn't have done it. They may have asked you to cancel the appointment, and it's really a good idea to have some advance notice on that so that you can get that appointment cancelled and reused. Or they may just say, look, I'm really feeling really bad, can you contact me? And there's a little bit of a clinical risk there because they've assumed that you will get that message. So as I said, unfortunately, we cannot stop those messages being replied to. So please ensure that somebody monitors this. And also, you could monitor the rejected. Just toggle that off for a minute. You can also look at your rejected messages. Again, tick box. So if the patient had a valid phone number, so all of mine have been rejected because I can't send them. But if your patient had a valid phone number in their F3 screen, but they've changed their changed their SIM card, then they're not going to get that message and it will bounce back to you. So by coming in here and checking your rejected messages as well, then you'll find any that didn't actually get sent to the patient and you can contact them by another means and find out if they have a new cell phone number. Okay, so we're coming to the end. Actually, we've whipped through this quite quickly. And you can type in your questions if you have any questions, and we can have a look at answering them for you. So let's have a look and see if we have any. So some of these webinars, it's a bit difficult to gauge exactly how long they're going to take, but if there's anything that you think I haven't covered, we can have a look at the questions now. So if you type your questions in, we can, I've got them here in front of me, so Chris is going to read them. Anything anything to do with the technical issues that you might be having, we will contact you back. So one question here from Maria is, do you still through the query build? So yes, you can still, as I said, you've probably sent that, asked that question before I covered it, but as you can see, you can definitely send messages out through the query build. Look at this one. Are patients, as a general rule, unable to reply? No, unfortunately, patients are able to reply. So again, it does help if you put please do not reply to this message if you've got space. It reminds patients not to reply and to ring the practice if they've got any questions. But unfortunately, no, there isn't a way that Medtech can stop the replies from being sent. So can we use Manage My Health if we use Connect Med? Yes. Oh, well, you can. It depends what you want to use Manage My Health for. So Manage My Health has a lot of functionality, but you can't use the Medtech SMS through Manage My Health and Connect Med as well, as far as I'm aware. But Chrissy might be able to, when she comes online, she may be able to answer that question for us. But if not,
yes,
I will.
Sorry, I didn't mean to interrupt you, Caroline. Yeah,
no,
so you can't use the Manage My Health SMS function as well as using Connect Med at the same time if you're using Connect Med for your online appointment bookings. Based on the way that they integrate, it doesn't work with the SMS solution of Medtech.
Okay. So do or can text messages go out automatically when making appointments? So again, that's something we covered at the beginning. Do you have further questions about that? Because we covered, well, maybe you didn't join us right at the beginning. Can you just put another question, or could you just answer that for me, whether Bethany, if you would like me to go through that again? I certainly can go through setting up automatic appointments. Beth, sorry, I was late, so I missed it. Okay, no, so because we have time, I can absolutely go through that for you again. Just 1 second. I'll just answer. I'll just have a look at Stella's question. Do we need to install Manage My Health before we can use it? So again, you may have missed that, Stella, so I'll cover that again as well. I came late, we bulk sending SMSs. Okay, so Alison, yeah, what if we've got time, I'll go through the query build SMS again. But otherwise, if you didn't get it, you can watch the webinar later or tomorrow, or you can go and watch the query build webinar that I did last week, which also covers sending text messages as well. And Stella, do we need to... It depends what you're using Manage My Health for. So if you are wanting to use the patient portal for Manage My Health, then yes, you will need to contact Manage My Health, and there will be a charge for this if no one else is picking up the tab, like some PHOs will pay for patients to be registered onto the Manage My Health portal. In order to use the text message service through Manage My Health, you need to pay for Medtech. So there is you purchase a text plan through, and if you want to do this, you can go through to sales@medtechglobal.com, and they will organize all that for you. So there is a charge to send the text messages, but you do not have to pay for Manage My Health. You do not have to access the patient portal, and so this is separate. It's just underneath the Manage My Health menu. So hopefully that's answered your question. And we'll go through and set up the appointment, automatic sending out of appointments. I'll just, it's over here. So to set it up, first of all, you've got to have had your documentation completed through sales, and they will send you credentials to enter into the Manage My Health SMS setup. So we're going to Manage My Health and to the SMS text message service and set up. So in here, you would enter your credentials that Medtech will send you once you've signed your SMS contract. If you if you don't have access to your server, then this will all be done through this can all be done through our support team. So once this is set up, you can choose. You can activate Manage My Health SMS, so there won't be any further charge for Manage My Health for this service. Then you can put a tick in Appointment Book Reminders. You can choose whether or not to have your text messages not go out between two certain time frames. So maybe from say 5 or 6 o'clock in the evening to 7 o'clock in the morning, regardless of when the patient makes an appointment, they will not receive a text message through that time frame. Put a tick in here, and then you need to set up your automatic appointment reminder. So the first appointment reminder can be sent out in an hour before, or you could select a day before. A day before makes a lot of sense. So, or you can choose 2 days or 3 days, but generally speaking, most people will send their first text message out at least 1 day before the appointment. And if you choose to, you can send a second appointment reminder out closer to the time. It's entirely up to you. So remember that if you've chosen a text plan, then if you send 2 appointment reminders, then every appointment is going to get 2 text messages, and therefore that's twice the cost of sending 1 out. Put a tick whether or not you want appointments to go. You cannot send automatic appointments through the queue appointment book, but you can send them manually in bulk. And whether or not you want the query builder, the patient palette, or the recall, or to be able to send them on recall. Then you need to go to the staff setup. And in here, for each staff member in your practice, you need to put in that they can send, that appointment reminders will go from this doctor's appointment template. Okay, so not all doctors in your practice may wish to have for their patients to receive a text message. So you can send them out for some doctors, but not for others. So that's your choice. Appointment queue, so if this doctor used the appointment queue as well and wants to be able to send appointments out from the queue, then you need to put a tick in here. To be able to send text messages from the palette, has to have a tick here, from the query builder, and from the recall. So it's not enough just to put the ticks in here. You also need to be able to put them in for each staff member. Okay, so once you've done that, then you need to select your SMS appointment template. So you need to have set your template up, possibly before you start this process, and then attach it in here. And it comes from the outbox. So this is where you create your text messages to send it out. So if we OK this and go into Medtech setup in outbox document, this is where you set up your outbox documents, but also your text messages. So if we go into new and give your message, some people use S for SMS, so they know, or to start with, or it might be an X or an SX, something to define the fact that this is a text message, not an outbox document. Test and the description of your text message. It goes into the document folder, but the format is SMS. So that is important. So if you leave it as a text message, you cannot use it as a text message, cannot use it as an SMS message. And in your document, then you would type your message. And usually you would use first names for patient text messages because they're generally considered to be informal. So we've got first name here, And then you can continue to type your message. Dear da da da, this is what your appointment reminder. This is your friendly appointment reminder from such and such a medical practice, and your appointment date and time can be selected from the encounter. Query the encounter. So you have your appointment date, and you can pop that in, and your appointment time. Pop that in. Okay, and then you can also type in, please do not reply to this message, which is a good idea. It probably stops most messages from coming in. And you go okay to this, and then in your Manage My Health SMS message service setup, on the Staff tab, select the message here. So this is the one I've just set up, and now it's available in here. So hopefully that's answered your question about sending out automatic texts. Have we got any more questions? Okay. So if the patient has 2 bookings, how do you get the earlier appointment sent, not the later? So if they, so the time, Chrissy, the time frame is, yeah, go on, you answer that one.
Yeah. So if there is 2 appointments, an earlier appointment and a later appointment for a patient, what's best to do is to go into the earlier appointment and ensure that the send SMS option is ticked in the appointment screen itself. So Caroline, if you just want to open your appointment book and double click on one of the appointments that you have in there, if you've got any. If you double click on Annie Smith's appointment and open it up.
So just move back. Okay, yep. So open the appointment book up.
Yep.
Appointment up. Come on, Gertie. Fire up. Okay.
And there's the appointment screen here. Yeah, so you need to make sure that these are ticked for the first appointment and unticked for the second appointment, or you can leave them both ticked and therefore they'll get a reminder for both appointments. So if you're finding that these are not ticked, the best way to create the appointment is using the new icon on the appointment book for the first appointment, and then do the second one by dropping them in or just typing their name into the appointment book as you would do. And then you can make sure that they're ticked for the right appointment reminder. I think you missed one there, Caroline, too, around, can you please confirm it's 156 characters for one text, including spaces? Yeah.
Yes, it is 156. And so if you come in, if you're composing, or if you want to test a template to see if you've not put too many characters in, then you can come in here and pop your text, and it will tell you how many characters and how many text messages. So you get both lots of information here. So it will tell you if you've gone to 157 characters, and it will say it's going to send 2 text messages. So you can then go back and shorten your message by a few characters, and it will then go out as 1. So this is a good area. So although you haven't got the counter when you create your text message, you can certainly test it in this area here. So you don't just cancel it afterwards, and you don't need to send it out. I hope that answers that question. Any more questions from anybody? What is the cost to practice per text message? I haven't got the costs, but they are on our website, I believe. So on the Medtech Global website, if you look under the heading for SMS, you will be able to download the application form, and I believe the plans are in there.
So it's actually on Insight, Caroline, sorry.
Oh, so it's Insight, beg your pardon.
Insight,
so Insight, yeah, you can download the application form for SMS, and the plan is on there. So you're not paying individually per text message, you're paying for a plan like you do for most, for your own data plans and things. And it will be a bulk load of, say, 2,000 text messages, or you can purchase unlimited text messages, although there is a limit to the unlimited text messages. People do believe that if you purchase an unlimited text message plan, then you can just use it and send millions of text messages out. It's not quite correct. Medtech will monitor how many text messages are reasonable, and depending on the size of your practice and the number of providers, and they will contact you if they believe that the text you're sending out an unreasonable amount of text messages, and they'll discuss it with you. So there's no cutoff, but it's a discussion that will take place. So I hope that answers that question. Are there any more? That's great. I knew this would be a shorter session than last week's because the Query Builder webinar is quite a long one, but it's hard to set up webinars with exactly the right time that it's going to take. So it's good that we finished a bit earlier. If you have further questions that you think of afterwards, you can send them to training@medtechglobal.com. They will then be forwarded on to me, and I'll come back to you and I can assist you and help you with any other questions that you might have in relation to this webinar. The webinar will be put onto the Insight portal either later today or by tomorrow, and you can access that again, so you can view it again. You can also let other colleagues in your practice know that it's there, and you can come in anytime and view it. It'll be there. We usually leave them there for a year or so, so there's no limit on how long we'll leave the text. As long as it's relevant and there's been no major upgrades to the function, we'll leave the webinar there for a length of time. So you'll also find other webinars in our webinar library. So you might find other webinars there that are quite useful. So it's a good idea to keep an eye on the webinar library because there's some very good webinars in there. So, and they can be accessed, Insight can be accessed away from your work environment. So if you feel like doing some work at home, you can use the web browser. So if you access Insight via the help in here, Help Insight Customer Portal, or from the icon on your toolbar, you can also just Google Medtech Global Insight on any web browser and log in from anywhere. So you're not restricted to just using the Insight portal in your practice. Okay, so I think I've imparted as much as I can right now. So thank you very much for joining. And we've got an Evolution SMS webinar tomorrow. And then next week we have a webinar on some of the setup options in Medtech32. So please feel free to join that one. Thank you very much. Goodbye.